Thank you very much. Delighted to be here to speak to people again. It's always a privilege, and it's particularly a privilege to follow someone like Susie, who knows a lot more about this than I do. I'm not an expert on dementia, but I think she is far more than me. The Local Government Association and the Dementia Action Alliance have just recently published a document which has got some case studies in of things that councils are doing in some parts of the country. I think you've got it in your packs. To help people who've had a diagnosis of dementia. In a way, I kind of apologise for the title. It should really be called Helping People with Dementia Live a Life. Helping people with dementia and their families live a life, you know, post-diagnosis support. We get caught up in the terminology. This is what the Department of Health uses, and I chaired one of the dementia champion groups, and we talked a lot about this. We talked a lot more about how to get a diagnosis than we did about what to do after that. So it's important that we talk about it, but it's, you know, the title's not very friendly, is it really? So what do we mean by it? So I think at the heart of this is it's the help that you need when you've got a diagnosis of dementia. And indeed, if you've got dementia and you haven't got a diagnosis, you still need this help. So that's important, and it needs to be personalised. It needs to be support for the individual and their carer, or family, wider friends, if appropriate, children, where that's appropriate as well. And it should be from all agencies. And it should be reflecting the different needs, wishes and circumstances of somebody. And not only is it not just health treatment, actually it's quite unlikely to be health treatment, certainly in the first instance. I mean, a lot of the help you need to start with is things like information. And then you might need some practical help. And there are a few people who benefit from ongoing drug interventions or from therapies, but most of what most people with dementia need is not health treatment, because at the moment it's not available. If it was available, it'd be great to have it. So we need to think about the broadest things that can help people live their lives. We heard about how devastating a diagnosis can be. It can also be a relief. So there's a bit of a mixed emotion there sometimes for people when they get a diagnosis. And even if the person themselves and perhaps their immediate family feels some sense of relief, they know what's going on, then there can be some devastation because other people don't know how to react, and some of your friends might become distant and family don't know how to manage. So those things can be really difficult. And what you really need is some appropriate and timely information and care and support to make sure you can stay as independent as possible, or your family and friends can help you stay as independent. You carry on doing the things you like doing for as long as you can. So not a one-off information pack, with a leaflet that says this is what's available in your area. I think, there's a place for that, clearly, and it's better to have some information than not to have it. But what you really want is someone to talk to and somewhere to go. You may not want immediately to talk to anybody, but you want to know where to go when you're ready to hear more, or you want to investigate more, or you want to plan further. And you may not, you're quite likely, if you get an early diagnosis, you're quite unlikely to need formal services straight away. So for some people, there's a huge gap between getting a diagnosis and becoming eligible for something like social care, or needing health interventions other than the regular interventions that anybody else needs to keep them healthy. And so what you need is that when you're ready to think about planning, and when you're ready to get some more information, that there's a place to go, and you know what you can do. And local authorities can help following diagnosis. They are probably less well placed to help than they would be if they were properly resourced. But nevertheless, there are councils up and down the country trying to do their best to make sure that some of these things are available. I have to say, it isn't as good as it should be everywhere, and a lot of the things that we'd like to do and know we should do fall at the expense of the things that statutorily have to be done, like the heavy end care, because of course you can't stop doing that. So there's a balance that councils are trying to strike all the time in terms of what they do. But I am pleased that the document you've got in your pack does show some of the things some places are doing. And often they're doing it in partnership with the voluntary sector, in partnership with other organisations, the NHS, and others in the area, sometimes local shopkeepers and so on. There's all sorts of people that can play a part, particularly if you think about the dementia-friendly communities, which I know you will have heard about today. So councils do have a statutory role to provide care, support, information and advice, but they also have a wider leadership role. They're now responsible for public health as well, so they have a role in trying to help communities stay healthy. And they also have a part to play in building dementia-friendly communities. Now, that's not happening in every part of the country, but actually the Alzheimer's Society has made sure there's pretty good spread around things like Dementia Friends. There's some schools that are actively engaged in becoming dementia-friendly schools. And there's quite a lot of communities that are scattering around the country that aspire to be dementia-friendly communities. And then at the right time, it's about arranging services. But in terms of dementia-friendly communities, there's a case study in the document from Kirklees, which talks about creating change locally, taking our environment in our place and thinking, what can we do to make it better for people with dementia to live in our communities. But councils also have a role to arrange services at the right time. And sometimes when you think about social care, you think about care homes, and maybe you think about home care. Sometimes you might think about day centres. But there's actually, if you use a personalised approach and use personal budgets or direct payments, whether you want real money or whether you want just choice, and there's all sorts of things that can be done, which can include helping you carry on doing the things you enjoy doing anyway, but find it hard to access. So it could be transport, it could be support to go somewhere. It could be, talking to the local organisation to help them understand how they can help you carry on when they might find it otherwise quite difficult. So it's everything from those kind of chats and links to the voluntary sector, information, equipment, assistive technology. We heard in one of the sessions this afternoon about GPS. Well, that's not for everybody, but it can be really useful. But there's all sorts of other things that can help reassure a carer that someone hasn't, wandered out of their house, or you can have the things that know whether you've left the gas on or the fridge open or the front door open and those sorts of things. So lots of sensors can help people, and ideally introduced early enough so that they kind of get used to them before it's too difficult to understand why things are happening, and best opted for by the individual rather than imposed upon them. Yeah, so you choose to have these things because you're planning, and you're planning because someone's helping you think about what you could do to help yourself live at home for longer. So it's those things through direct payments. It's breaks for carers and support to carers through organisations like Carers UK and local organisations like that. I live in Hertfordshire. There's an organisation called Carers in Hearts. It's supported by the council, but of course it has all sorts of its own activities as well, and is highly valued by carers in the county. But it's everything from that through to things like Admiral nurses, which were mentioned earlier. And again, there's a case study in Doncaster about how the Borough Council is engaging Admiral nurses to support people through their dementia journey. So what does good look like? Well, it's easy to say, isn't it? Ensure all professionals understand dementia. What do we mean? Do we mean accountants, lawyers, shopkeepers? Because actually, if people with dementia want to live a life, everybody's got to understand. Not at different levels for different people, but even let's think about consultants, hospital, NHS consultants. They specialise largely, don't they? So if you're a specialist in mending hips, I don't know what the proper word is, but if you're a specialist in mending hips, you may not know much about dementia. But actually, people with dementia need their hips fixed. And people with dementia get diabetes and need to go to the dentist and need to have their feet looked at by the chiropodist or the podiatrist or whatever the correct term is for that. And so those professionals, just in the health service, need to understand how to provide those services to someone with dementia. And so there's a really broad job here, which is for the health service and councils, but for councils to kind of promote as something that's important. And it's equally important in families as well, so councils can help families understand dementia in someone that they care for and they love. And engaging directly with people with dementia and their carers in terms of not just telling them things or consulting them about things, but actually there's a couple of case studies in here, I think Bracknell, Forest and Brent, where you've got co-design going on, asking people with dementia and their carers, what is it you need in your area and how can we help put it in place? And sometimes there have to be compromises because what's ideally wanted is not affordable or isn't achievable in the short run. But actually, if you co-design with people, people understand that resources aren't endless, but how can you best use the resources you've got to provide the best range of services and support? that is possible. And making sure that information is accessible and designed with people with dementia. So the Warwickshire Living Well with Dementia website is an example of that. And I remember when I was engaged with the Prime Minister's Challenge when it was first launched, seeing a Living Well with Dementia handbook. I think it was Gloucestershire had put together. Everybody with dementia got, and it had lots of information in it, and you could use it as an ongoing record. Well, maybe some places people would prefer websites, some people prefer handbooks, but both should be available. And I remember labouring long and hard to try and get something similar in Hertfordshire when I was working there, because I'd heard from people. I had people, in fact, I had one thrust into my hand at a conference by someone who'd been given it because they had dementia and said, "This is the thing. You know, I brought it to give you because this is the thing that I found really useful." So, okay, so let's see what we can do with that. I didn't ever manage to get it up on the national agenda, but I did manage to get it on the local agenda where I was working. Access to support for carers I've talked about, and access to all services. And important that people are enabled to help to plan, including to plan how to change their home, including perhaps sometimes thinking about, well, where should your home be? Because it's not a choice between, so you may want to stay in your own home, and that may be fine, and that may be possible. And I know someone very recently, one of my colleagues had a parent with dementia who lived right into severe dementia in her own home with support and died at home. You know, and so it is possible for some people. It's not possible for everyone, but it's not a choice between where I live now and a care home. There's specialist extra care housing for people with dementia in some parts of the country, or non-specialist extra care housing, which can cater for people with dementia. And sometimes extra care housing because in your family you've taken your mother and father and helped them to stay together and support them, but actually not everyone could do that. So maybe extra care housing can help a couple stay together where otherwise one part of the couple might end up in a care home and the other would be parted from them. So there's different ways of thinking about it, and needing to help people plan around that. And I think the Worcester project in here talks particularly about something called a dementia grant. So it's like a dementia facilities grant. So it's like a disabled facilities grant, but actually targeted to help you organise your home for dementia. So it's an innovation that they've used in that area. So there's lots of challenges, and I think I've been talking about them largely as I go along, but raising awareness of dementia more broadly and making sure that the other health professionals and other people, I mean, the Dementia Friends initiative, I think, is great because I've come across all sorts of people in all sorts of walks of life wearing those little blue badges. So it's not everything, and it won't help support children who might need a lot more support than that. But actually, if you've got some dementia friends in your local shop or in the queue in the supermarket or serving behind the counter or in the hairdresser, it kind of helps. And so that awareness is promoted by more people knowing a little bit, as well as by key people knowing a lot and a lot more. So I think that's important. And I probably will have left one of these examples out, but in the London Borough of Havering, they have a training initiative, which is a broad training initiative of trying to help people to understand about dementia, you know, at all different levels for all different people. But resources and funding are critical. So resources not just for things like research, but actually for delivering that day-to-day care. And we have got this big challenge, haven't we, where dementia is treated differently to other diseases. The support that councils provide is means tested. The support that health service, all councils provide for cancer is not means tested. So those are challenges that perhaps the green paper that's currently being discussed might turn its mind to. In fact, one of the proposals put in the Conservative manifesto got called the dementia tax, didn't it? Because people saw what they thought the implications might be. Actually, I'm not sure I agree. I think you've already got dementia tax at the moment because effectively the means test says actually you pay differently for that disease than you pay for other diseases. And in Greater Manchester, which is seen to be quite leading edge in terms of integration of health and care, they've got something called Dementia United. So they're trying to see dementia as a thread through all of the services that they deliver. And I finish with that one because I think it's broader than the other examples. I think a lot's been done. I think when I was involved with the PM's challenge and we talked about, we talked so much about getting the diagnosis numbers up, and we didn't talk enough about post-diagnostic support. And when we did, we tended to forget the some of the very day-to-day type of support and help that people need. So we talked about the immediate information packs and navigators and things. Well, you need those, but you also need support for carers, things like home care, personal budgets that enable you to carry on doing what you want to do. So thank you very much.